Hello, and welcome. In this video, we will explain the most efficient way to learn using the Diagnostic Imaging Tutor system. Before starting the study, everyone is required to watch this video. The Diagnostic Imaging Tutor system consists of two tools. The first tool is the Diagnostic Imaging Navigator, called Doc.navi. The second tool is the Diagnostic Imaging Simulator, called simu.Doc. Doc.navi is used as a textbook and a reference guide. simu.Doc is used as a question bank and a practice drill. By using both tools together, you can learn step by step and in a very efficient way. For more information, you can download the guide by clicking the PDF icon on our homepage. When you are ready, let us begin. Efficient use of the Diagnostic Imaging Tutor to master diagnostic imaging. Chest radiography. Do you think the Diagnostic Imaging Navigator, Doc.navi, is about navigating diagnosis, and the Diagnostic Imaging Simulator, simu.Doc, is about learning diagnostic imaging? That is not correct. Now we will show you how to use the Diagnostic Imaging Navigator, Doc.navi, as a textbook and/or reference book, and the Diagnostic Imaging Simulator, simu.Doc, as a question book and/or drill, so that you can learn the Diagnostic Imaging Tutor efficiently. First, let's check your level of understanding by taking the level check test in simu.Doc Basic. Log into the Diagnostic Imaging Tutor, select simu.Doc Basic, then choose Level Check. 20 questions will appear. Click the Start button to begin. Here is the first question. A question image will appear. This image can be enlarged to observe details, and you can also view the lateral image for closer observation. The question asks you to select the abnormal shadow from the options. By clicking the book icon, you can review a typical abnormal shadow. Select Enlarge, and then click the Check Answer button. The correct answer and explanatory commentary will be displayed. Please continue solving the remaining questions in the same way. There are a total of 20 questions. When you finish the level check test, if your correct answer rate is 30% or less, please start learning from simu.Doc Basic, difficulty level 1. If your correct answer rate is between 31 and 95%, please start learning from simu.Doc Basic, difficulty level 2. Please continue learning and repeat the exercises, selecting the regions of abnormal shadows, abnormal findings, and diagnosis. A total of 330 questions until you can answer all questions correctly on the completion test. If your correct answer rate is 100%, please proceed to simu.Doc practice. You will answer questions according to your level of understanding, but now we will explain how to learn efficiently using Doc.navi. Did you notice the avascular area at the left apex field on the level check test in simu.Doc Basic? Chest X-ray images are categorized by area: lung, mediastinum, bone, soft tissue, and pleura for both right and left sides. Please understand the characteristic images of diseases that commonly occur in each area. For example, if you want to understand diseases that frequently occur in the apex field, launch DocB simultaneously. On the navigation screen, select the apex field and perform a case search. When you check the diagnoses that frequently occur in the apex field, you will find that pneumothorax is very common. Click here to filter and display only pneumothorax cases. Then, by narrowing down to pneumothorax, you can review various case images of pneumothorax in detail. 3. You can also use Doc.navi to understand the typical images for each of the diseases. Click the drop-down button for pneumothorax, then click the Case Search button to refer to case images. If you look within the red frame, You will see that the characteristic region of pneumothorax is the apex field and characteristic findings is the avascular area. Then you can proceed to the case images of various avascular areas to further understand this. You can also refer to the disease explanation button for understanding of the disease, for example, pneumothorax. Click the output button after the disease explanation button. 4. It is critical of importance to understand the wide range of normal chest X-ray images so that you are able to identify abnormal findings on chest X-ray images. Many normal images can be seen in Doc.navi. You can also view YouTube Diagnostic Imaging online course. Let's understand normal chest X-ray images to understand 1. Element of chest X-ray images, 2. Division of lung fields, 3. Normal structure and border. 5. Once you master simu.Doc basics, you will proceed to the next step to learn the process using simu.Doc practice. The number of questions. Introduction, 180 questions. Beginner, 340 questions. Intermediate, 360 questions. Advanced, 72 questions. Learning target, medical students, introduction and beginner. Medical doctors, introduction, beginner, and intermediate. Medical specialists, beginner, intermediate, and advanced. Even if you have once mastered it, you might forget cases that you do not often deal with. So please check your own understanding with simu.Doc and Doc.navi in a timely manner. Doc.navi covers 120 diseases, about 500 cases, indicating the relationship between basic region, basic findings, and diagnosis. The figure below shows a number of pneumonia cases being identified using Doc.navi. Always keep Doc.navi on hand, and whenever you feel unsure while practicing image interpretation with simu.Doc, refer to Doc.navi to confirm any questions you may have. On our YouTube channel, Diagnostic Imaging Online Course, you can find useful videos for mastering diagnostic imaging, including how to use Diagnostic Imaging Tutor. Please make sure to check them out.